Okay, once you have a subscription to Pharma TouchStone online, you want to go to wavedata.biz and log in. Once you get into the website, there are a number of things you need to know immediately. The first of these is that you can change your password, and you do that by clicking the helicopter. Clicking the helicopter shows a pop-up, and there's a change password link on that. Click the background in the pop-up to get rid of that. And then fairly close to the helicopter you'll see the word molecule with a big dark blue question mark next to it. If you click that question mark, that tells you whether your company subscribes to the complete database and all products, or whether they've limited their subscription just to one or two molecules or product groups. You will also notice near the center of the top of the screen there's a date, latest date. That's because the database behind this website is updated twice a month, generally on the 14th or 15th of the month, and again at the end of the month, and it gives you some certainty that it has actually been updated and you're dealing with recent data. The way the screen is organized is the 5 colored boxes across the center of the screen are the data input boxes. That's where you put information that you want to actually use to generate reports. And the reports themselves occupy the lower half of the screen and are broken up into groups of 3 or 2, each one being a column. The first one to see over on the left hand side is the detail reports. There's 3 of those, and then there's the trend reports, again 3 of those. Then there's 2 reports described as analysis, and there's a couple of reports that are described as other. If we actually go into a report and have a look at it, the first thing we have to do is to put in something to the data entry, one of the data entry boxes. So this generally means you put in the first 3 or 4 letters and you wait for the pop-up to appear, and then choose something from the pop-up. So if you put in CIT, for example, and then you wait, eventually citalopram will appear, and you can choose that if you're allowed to look at that molecule. Then running a report simply means you click the Go button. And once the report has run, you'll notice that near the top left-hand side of the screen there is a big green box which allows you to do free text searching. So if, for example, you were looking for AAH information, you'd simply type AAH into that box and it will then sort it and limit the data down to just what you're looking for. If you remove that entry and look at the brown boxes slightly below the green one, that will allow you to filter on particular products or price lists or whatever you need to look at. And the advantage of this type of filtering is it will allow you to choose more than one entry. So you can repeatedly use the drop down to actually select different items. And that means that you can actually build a list of something that's specifically important to you or your company. Once you've decided to remove that definition, and you just put your cursor over the name of the product or the price list or whatever it is you've chosen, it'll put a line through it, and by clicking it, it removes it. Clicking all of them takes you back to the beginning and all the data again. You will notice that in some browsers, each report you run appears on a separate tab. In other browsers, it actually starts a completely new session. But to get back to the main screen, either go back to the previous tab you used or go back to the previous Internet Explorer session you were running. And the last thing to say is up in the top corner there's a block which is the global settings. That allows you to actually decide what you want to run reports about. So you could limit all the data you're running to dispensing doctor or parallel imports, or if you're subscribed to Ireland you can swap between the UK and Ireland there. It's also worth saying that above each report there's a dark blue small question mark. Clicking that allows you to see more about the report in detail and to understand what it does before you actually try to run it.